several patients that because of one's house, is it husband or wife's house? When you are going to your on the day of your wedding, what do they used to call that day now? There's this preparation, very strong preparation that you make. Yes, a lot of it. So as they are preparing the women, some of the young men will also corner the groom and say, guy, don't dull yourself because that woman will finish you this night. Including recently, just last week, yes, I had a patient. So they will give him all kinds of concussion, essentially for what? For erection now, so that you don't dull yourself that day. The problem is not the drug. The problem is the possible effect. Because that's why they came to us. What was the problem? They took the drugs, the erection was great, powerful, but it refused to come down. So they became my patient. That we call priapism. When you have erection, call my number very fast. Even if it's in your bedroom, even if it's in your matrimonial bed, even if it's on your matrimonial bed, I need to intervene. Okay, so the causes are essentially grouped into two major areas. I call the first one organic problem. Organic problem are things that happen in our body, changes that happen in our body, diseases, disorders that happen in our body that can cause male sexual dysfunction. Example, if somebody has spinal cord injury, not very good. The erection even may be there, but it may be uncontrolled, erratic. Somebody has diabetes that is poorly controlled. Not because you have diabetes, you have problem. No, it is the control. People that are careless with their health that allow the diabetes to now create damage. Usually diabetes will affect nerves, it will affect blood vessels. And all these are components of the male penis. And once they damage all those things, we start struggling with the issue of erection. So these are organic causes that we can lay hands on. But the more unattended cause that people give less attention are the psychological ones. And we're going to talk about them soon. So male sexual dysfunction is why we are here. You see, all these things I've done is introduction. If I don't do this introduction, you cannot understand whatever I want to say. So male sexual dysfunction. Next slide. This is what is the consequence of when dysfunction is too much. When the bed should be shaking, the head is shaking because there's no result. Next slide. So sexual dysfunctions, I've categorized them based on the sexual cycle. Isn't it also? We said the phases of the sexual cycle include go back. The first, we have 4 phases of the sexual response cycle. I said there's the phase of desire, isn't it also? Even before you touch your partner, once you begin to desire her, what happens to your mind? That's why when the Bible says when a man desires, because the thing begins to change. If you are watching an American film, there's usually these 5-10 minutes of every American film that is meant to play with your head, scatter it, so that you want to watch the film again. They show erotic scenes. How do you know that you are guilty? Anytime you are watching it and your body is responding, you are beginning to get guilty. So libido, that's what we call sexual desire. So the dysfunction affects phases. And when it affects desire, the desire can be affected, meaning the person can have low sexual desire or very high sexual desire. This is usually a hormonal problem. The hormones of female that run a normal woman is estrogen. And depending on the menstrual cycle, estrogen and progesterone, they fluctuate. So there's a normal estrogen for a particular time. During pregnancy, estrogen drops. Progesterone becomes more. But in a normal female, estrogen is predominant. In a normal male, testosterone is our hormones. Is our hormone. That's the hormone that runs us as men. Everything you are as a man now is a product of testosterone. All these muscles you are carrying are testosterone. Your strong bone is testosterone. This game, your beard is testosterone. This voice is testosterone. So we are essentially the product of these hormones in our body at work. So anytime the hormone goes low, you'll find your sexual drive dropping. So that's why when you see a woman having hormonal imbalance, all those trouble, usually they will say, let's check the hormones levels. You know, so same thing in men we do. I've had patients recently coming to me with low sex drive. Check their hormones low. I gave them something to improve it, and there was a result, which I will not tell you so that you not buy it. Now, there can be problem with arousal disorder. Arousal. Meaning that even though you have the desire, the body is not waking up for the thing. And the common problem is what? Erectile dysfunction. For a man, he desires, this one can beat down a man psychologically. Because a word from the wife can kill everything. In fact, even for the people that are normal, the man does not have any problem. That's why sometimes it's better to sellotape the mouth of a woman, because if she drops a negative word, everything will just close, the curtain will just close till next time. So some people have problem with orgasm. Some people cannot even achieve orgasm. Some people have very long delay. For a man, if you stay 25 minutes having sexual intercourse, something is wrong with your orgasm. You are not able to ejaculate. You can't reach orgasm. Something is wrong. The much more undesired is premature ejaculation. You start within 10 seconds. 10. The thing has finished. Then she open her mouth and look at you. Then your ego will drop, and then that's the beginning of problem. Then other problems start result from pain. Pain. Anytime a person is having sex, male or female, and you're having pain, there's an underlying problem, and we can treat it. Next slide. So let me go fully into my day. Today I've been asked to speak about male sexual dysfunction. Let me see what time I have left. Wow. So male sexual dysfunction does not mean erectile problem or impotence alone. It is a group of problems. The reason I want to run through them, even though I don't stay in them exhaustively, is so that you can recognize it. Maybe your brother calls you, or people are gisting with a friend, and he mentioned that this, you will recognize that is a problem. He needs to see a doctor. Because of our African setting, most times, people don't like to see doctors. They don't want to go to hospital. They don't want people to know they have problem. Meanwhile, answers are there, waiting for you. So inability to achieve a satisfactory sexual relationship, which may involve problems of erection, problems of emission, problems of ejaculation, or problems of orgasm, form male sexual dysfunction. And look at them here. Erectile problem, premature ejaculation, retrograde ejaculation. There are conditions where a man, when you get to orgasm, remember, not all ejaculation is equivalent to orgasm. But most times, orgasms end with ejaculation. So a man at ejaculation expects to see semen outside, isn't it? What he has finished releasing, the ejaculate. But he finishes, has the feeling and everything intact, but nothing is out. That's what we call retrograde ejaculation. The semen return to the bladder instead of coming out. Can his wife be pregnant? No chance. So you have problem with fertility. There are medical conditions that can cause it. There are surgical conditions that can cause it. There are drugs that can cause it. So that's why you need to visit a doctor for proper evaluation. Retarded ejaculation, very little comes out. We ask for 1.5 mil as a standard. Somebody is bringing 0.5 mil. May not be adequate, may not even move enough to cause pregnancy. Painful ejaculation, and then post-orgasmic illness syndrome. It will have been good to stop here, but let's look briefly into a few of them. Next slide. Erectile dysfunction. What is erectile dysfunction? It is the consistent or recurrent inability of a man to achieve. There's difference between achieving it and maintaining it. So when you have achieved erection, you should be able to maintain it for at least 3 minutes. For sufficient, the erection that is sufficient for satisfactory sexual performance. It is not a threat to life most times, but the psychosocial consequences can be very serious, from reducing the quality of life of the person to affecting his self-esteem, may result in anxiety, depression, can cause spousal infidelity. The partner may start looking out. If I don't get this thing from you, I'll look out. May even result in separation and divorce. It may result in reduction in occupational productivity. The man is at work, instead of being productive, putting his hours into work, he's worried about the challenge at home. So when he gets home now, somebody will lash him with a mouth. It is common, usually between 40 and 70 years, 52% of men have some degree of erectile dysfunction, what you call impotence in English. Some degree, meaning that we have the mild type. It's not very serious. Man can still go on with his life. Usually the younger age group, maybe 40 to 50. We have the moderate type, beginning to have effect. And then the severe type is usually commoner with older men. But you know, we have older men that are still marrying wives and they are doing well. So it's not common with everybody, but the likelihood is common with age, as age increases. So for normal erection, 3 major things that we need. Healthy blood supply. To where? To the penis. No blood, no erection. After all, that thing you see standing straight is blood that full inside. Blood. Good innervation. Your nerves, your penis is well innervated, means the nerve supply must be excellent. And that nerve supply extends to the brain and spinal cord. And then excellent hormonal level, testosterone. Your hormones, your nerve, and your blood vessels, these 3 must be intact. And generally our problems, the origin of the problem, the organic ones, are spread across these 3 areas. So we have 3 types of erection. Tactile erection, reflexogenic, psychogenic erection, and then nocturnal erection. What do I mean? Erection that comes because of touch. There's a way, it's work you are even going to serve. Your wife finished from the bedroom. There's a way she brush you. Something will begin to react. It's because of contact and transmission. Is it also? Tactile, that erection comes because of physical stimulation. That's the tactile stimulation. There's another psychogenic erection. There's nobody there. But maybe you remember an event. Or sometimes a man is far away from his family and he's going to stay 1 year, 5 months. And he's just wondering, Kai, my wife is far away. So all he needs is to throw back some events between him and his wife, and he has some changes in his body. Those changes, that type of erection is psychogenic. It's happening in the brain. And then the last type of erection is very key to us as urologists. If you don't have it, we are worried. We call it nocturnal erection. That one that happens in the early hours of the morning. And couples can take advantage of it. You can promote it to the next level. We call it nocturnal erection or post-nocturnal tumescence. That early morning one that when you wake up, as a young man, you are not married, the thing will be disturbing you. Those days when I was very young, I used to say, Lord, take it away. Later I say, yeah, it's important, leave it. So don't take it away because it's very important. It's a marker of good things that is to come in the future. You wake up, you wear your boxers, and the boxers is tight suddenly. I didn't see anybody, I didn't discuss with anybody, nobody stimulates me. It's important to that early morning erection is a sign of good things to come. We have many women coming to us with their 5-year-old, 3-year-old say, I am not seeing anything in the morning standing. They are coming to report at 3-5 years old. Yes, you should see it in that your small child. See it. See it. The thing should stand from time to time. Say, praise God, we are doing well. Okay, so erection problem can be primary, meaning that the man has never had erection. So his problem must have happened from the mother's womb. Or it can be secondary. Somebody that is doing well over the time, problem now creeping from different causes. Next slide. Let me move very fast. I'll hit the key things so that we can have time to look at it. Now, we want to classify erection problem. Basically, we classify it into two major things. It can be psychogenic because, and this is the one many people miss. The problem is coming from the brain. Not because the man has brain injury, head injury or anything, but it's a psychological problem. So, when people begin to age, age-related decline, I've mentioned that age will naturally bring a decline in erection. Chronic disorder of sexual intimacy. This one is a psychological intimacy with another person. Situational is where a person, there are specific situations where a person can only get erection maybe towards a particular person or a particular object. So imagine that thing is not your wife. You are in trouble. You can get married with only that wife. Wherever there's conflict, erection used to disappear, settled. There's peace. Things will now work. But in the heat of fight, it doesn't work because it has to do with psychology. Performance related. When a woman begins to put pressure on the man, comparing him with past experiences, then the man will be inside serious problem. Either for fear of not meeting up expectation or the anxiety of performance. Once you allow your mind, I said sex has two components, the physical and psychological, and you need both to have good, healthy sex.